arrive.
I realise I'm competing with a very gorgeous sunny day outside.
We've had lots of sunny days this spring, so I think the appeal's begun to wear off, really.
Full group today. I'm sure more people will join. We'll give it a few more minutes. Oh, there we go. Some more people coming now. I think we'll just give it another minute. Okay, should we make a start? I think it's just quite a small group today. Maybe the sunny weather has lured people outside. So thank you everybody for joining. We've got a guest speaker today, so Lucy Griffiths from Swansea University. Just before I hand over to Lucy, just wanted to let you know that our meeting next month currently is to be confirmed in terms of a speaker, but we have got one more session before the summer break, and then we'll be restarting back in September. So that's on the 17th of July. So we'll let you know once we have a confirmed speaker for that session. Other than that, I don't think there's any other announcements really to make for today. So Lucy is going to be talking to us. I think your title, hang on, let me find it, was Who Cares for Children Using Administrative Data to Build the Picture? So I'll hand over to Lucy and let you introduce your talk. Thank you.
Thanks, Yvonne. Share my screen. I'm conscious that in Teams, when I share my screen, sorry, a second, 1 second. Just going to share again. There we go. Sorry, I was going to say that I'm conscious that when I share my screen in Teams, I can't see you or if there's any hands up. So if anyone has any questions as we go along, please do interrupt me. I was happy to take any questions at the end. So I'll kick off. My name's Lucy Griffiths. I'm based within population data science at Swansea University. This is the title I gave you, Yvonne, Who Cares for Children Using Administrative Data to Build the Picture. But as I prepared, I decided to make a change and make a statement instead. So we care for children. How really can we use administrative data to build a better picture of their lives? So today I'm going to give you an overview of 3 current projects, one that's creating new evidence, using administrative data, one focusing on the development of a new longitudinal study for children at risk of poor outcomes, and then one project that's showcasing the value and the opportunities for research within the field of children's social care. And then I'll finish off by giving it an overview of kind of where the field of administrative data is going. So I thought I'd start off with a graph that's completely unrelated to children's social care, or possibly. So we see lots of graphs and figures in our line of work, of course, but this one's really had a kind of a lasting impact. And it shows the heights of 5-year-olds by year. So you can see that in the UK, though not in other comparable Western countries, the height of 5-year-olds has been falling since 2010. So children in the UK are becoming increasingly stunted. And this coincides with the post-2010 austerity years. And we also know, of course, that a significant number of children are living in poverty. If you're interested in this, then there's a kind of related a book published by Danny Dorling that's a fantastic overview of the work that's within this area and the lives of children and young people, and the graph was taken from this book. But why is this of relevance to today's talk? Well, those of you who know me will know that I have a really broad range of research projects. I consider myself an epidemiologist, and I'm interested particularly in children's health. But as we know, children's health is really influenced by a range of social determinants, relating to what's going on within the home or the wider environment. And admin data, just for if anyone's on the call is not aware of what admin data is, it's the information created when people interact with public services, such as schools, healthcare systems, welfare systems, courts and benefit systems, etc. And this figure here is really trying to map the world in which we live using administrative data. So we can use administrative data to really understand the impact of where we live, other environmental factors, policies, etc., on the health of individuals. And so just to define data linkage, that's been defined as the bringing together from 2 or more different sources data that relate to the same individual, family, place or event. And so this can include the linking together of admin data sets. And the concept of record or data linkages actually dates back to Halbert Dunn, who was based at the National Office for Vital Statistics in the US, who in 1946 proposed the creation of a book of life for each individual from birth to death. And that was, he proposed that should incorporate key health and social events, which could then be used in health service planning. And so the exponential growth of routinely collected admin data from across different policy areas provides the potential to put together these powerful insights into complex societal issues. Okay. So I wasn't sure when preparing my talk who on the call may be familiar with the SAIL data bank. So just briefly to let you know what that is. This is a secure anonymized information linkage data bank hosted by Swansea University. Of course, it's a trusted research environment that brings together a range of different admin sources. And of more direct relevance to my talk today, these are some of the data assets that we hold. So we have information from the family justice system, so that's information on private law, public law. And then we have information from all children involved in social services across Wales. So we have the Children in Need census, which was then replaced by the Children Receiving Care and Support. And then we have Children Looked After records as well. And of course, SAIL enables linkages to be made between these different data sets and a range of other information using unique identifiers. So we have health data, education data, information on residential residential information. So for example, we understand where people live, survey data. We have the 2011 and 2021 census data. And then more recently, we have some data sets from the Ministry of Justice. So for example, the prison data and the Crown and Magistrates court data. So why use children's social care records? They'll enable us to gain powerful insights and to identify where change is needed, policy or practice, to improve the lives of children and their families who are receiving care and support. Of course, it provides a mechanism for therefore then monitoring changes over time or in response to particular interventions, and also for identifying disparity. There are a number of methodological advantages. It avoids the high costs and low response rates or attrition of longitudinal surveys. Because they're national records, they are representative and sort of larger samples. And importantly, I think for this area, it really avoids the need for individuals to disclose perhaps sensitive or traumatizing events. The data we have is it spans a very long time frame, so it's possible to track a child's life over time, including into adulthood, and then it allows their journeys to be understood within this context, so we can understand their journeys into the care system, through the care system, and then outcomes for children involved. And when you combine children's social care data to the other types of data that we hold, for example, within the SAIL data bank, then you get that really rich picture of an individual's life. However, I think it's really important that data should be accompanied by qualitative work or surveys to gain more in-depth insights into the experiences that we're seeing through the data. And also, of course, really important to incorporate the views of those with lived experience to then inform changes to services and children's outcomes. So the Family Justice Data Partnership was a collaboration, 4 or 5 year collaboration between Swansea University and Lancaster University. And we produced huge amount of new evidence related to children involved in care proceedings. It was called the Born into Care series, which was led by Karen Broadhurst, based at Lancaster University. There's lots of examples of different work that we've done, focusing on children and young people, both in terms of the nature of the care proceedings, the health, for example, of the children and young people themselves or of their caregivers, evidence related to repeat care proceedings. We did some intergenerational work looking at care experience mothers who then go on to have a child herself involved with care proceedings, and a range of work around the vulnerability. So all of these reports are available on our Swansea University Family Justice Data Partnership website. And I just wanted to highlight here some examples of impact. Of course, having positive impact is why we do our research. And so some of the findings fed into the perinatal mental health programme, into the NSPCC manifesto, into new guidelines, into the PAUSE programme, and then Jigsaw is a good example. So that was a service within Swansea, and the Born into Care research enabled or informs, contributed, I guess, to the kind of development of Jigsaw and the extension of it. But today, I'd like to outline some projects that are currently ongoing And the first one is called the Comfort Project. So it started in January this year. It was a 2-year project. It's called Child Outcomes for Mothers Facing Trial. And this is the team. Again, it's a collaboration predominantly between Swansea University and Lancaster University, and then the University of Lancashire are also involved. Karen Broadhurst is the PI, and we're co-PIs. And so the project aims to deliver the first ever quantitative analyses of mothers and children at the intersection of the criminal and family justice systems, which we know, or we aim to then provide insights about the caregiver arrangements for children. So we know that women's involvement in the criminal justice system impacts on their relationship with their children. And so whether a woman is actually in prison or serving a community sentence, their criminal justice involvement can have a significant and a detrimental effect on the children's caregivers arrangement or children's outcomes. And so what's unknown, though, is the proportion of mothers who appear in the criminal justice system and the family justice system. And so that's the kind of evidence we're trying to calculate. And then we want to look at what the impact is on the children's caregiver arrangements. So, for example, within Wales, we can then look to see the number of children who enter into care as a result of their mothers being involved in the criminal justice system. So how are we doing this? We aim to be to maximise on the routinely collected data and to build on the work of ADR UK. ADR is Administrative Data Research UK, who are helping to unlock public services data. So through ADR and the Data First programme at the Ministry of Justice, we've just received a number of Ministry of Justice data sets into the Cell Data Bank that we'll be using. Then we'll also be linking these criminal justice information or data to family justice data. So we are collaborating with the Data First team at the Ministry of Justice, with CAFCAS and CAFCAS Cymru, and then with Birth Companions, a charity organisations that supports mothers. And then we are extending the work that we as a group carried out as part of the Family Justice Data Partnership. So whilst a number of the data sets within SAIL pertain just to residents within Wales, we do have some data sets. So, for example, the criminal justice data and the family justice data that spans England and Wales. So those are the nations we're going to be looking at for this current project. So we're going to be looking at all mothers and children appearing in public law and private law family justice cases, all female defendants appearing in the criminal justice system, so those within non-custodial and custodial sentences. And then we'll have got a sub-study, so for then all children in Wales, we will also be able to look at their care status. So it's quite an ambitious project, data-wise. So it's been funded by the SRC for 2 years. We are currently navigating the SAIL application process in terms of predominantly at the moment the MOJ approval panels. But we should, once we get the data, it will be at least sort of 9 to 12 months to create our data sets to then use to inform our analyses. So this is a bit in depth, but just to give you an overview. So the first data set we'll be creating is looking at the CAFCAS records linked to the Ministry of Justice data. We then be bringing together the criminal court data sets And then the next stage then will be linking the family court data sets with the criminal court data sets to identify families involved in both systems, so the family and the criminal justice system. Then we will be creating a Welsh data set, which is bringing together all of the other sort of health, education, child welfare information that we require. And then we'll be linking all of those data sets together to create our final data set. So a significant amount of work for the data scientists involved on the project. So that work is currently in process in terms of the SAIL application, but we're obviously developing our study protocols and making our plans for data linkage plans in the meantime. And then we've also created this Comfort Together, which is, we've brought together a group of mothers with lived experience. This has been facilitated by the charity Birth Companions to ensure that we are incorporating perspectives of women with cross-justice involvement into the study. And they will also help, they will inform the research and help us to get our kind of science communication targeted right. So that's the Comfort study. I'm going to move on to outlining a different project that we're working on at Swansea. This is a study to scope the feasibility of a new longitudinal birth cohort study of children at risk of poor outcomes across the UK. So within the UK, we have a tradition for having very rich longitudinal birth cohort studies. Some of you may be familiar with the Millennium Cohort Study, which commenced obviously at the beginning of the millennium, in the year 2000, and persons involved are nearly 25 now, but it's created such a wealth of information about it's about 19,000 mothers, the original cohort. So but there hasn't been a new study, longitudinal study since. So there are plans at the moment as a group working at UCL trying to obtain funding from the SRC to establish a new longitudinal study. And what we're doing here in this study I'm going to talk to you about now is we're also scoping the feasibility of a birth cohort for children who are not usually incorporated in those traditional longitudinal studies. So they're more seldom heard. They're definitely more difficult to recruit and to maintain for longer follow-up within the study. So that may include, for example, children classified as more vulnerable. So, for example, children involved in child welfare system, or children born into families with greater vulnerabilities. So there's 4 work packages for this project. So we're just about a year into the project now. So the first work package has involved workshops with policy and community stakeholders to really understand the value of such a longitudinal study and the evidence needs. A second work package, which is what I'm going to focus on today, is using administrative data to understand how it can be used to sample our population. So I'll come back and talk to you a bit more about that. And it's also involved discussions with data controllers across the UK. The third work package is led by colleagues at Cardiff, and that's scoping and reviewing existing studies, again, to improve our understanding of retention and engagement strategies. And then Rachel Vaughan and Cascade has also carried out some consultation with care experienced young people as well to establish their views. And then the final work package, which will be based on findings from the previous work packages, will be to establish sample sizes required to address the key evidence needs and to estimate potential costs. So just going to the administrative work package. So we are accessing data within the cell data bank. We are using the eChild data for England, and we're using EDRIS, so Research Data Scotland. And what we're trying to do is harmonise some analyses using data from these three nations to give us insight into the numbers of children involved in the child welfare system, but also to understand the numbers of potential families with vulnerabilities that we may want to draw into the study. I thought I'd better give you an overview just in terms of numbers and what sort of size we're talking about. So within England, the estimate is that 1 in 29 children. So if there's 29 children in the classroom, one of those will be receiving care and support. It's slightly lower than that in Wales, but within Wales you can see that we have more children on the Child Protection Register and more children looked after. Okay, so we're using these admin data then to look at maternal characteristics. And these are some of the areas here that I'll go on to talk to you about. So teenage young mums, mental health, those who may be experiencing domestic violence, substance misuse, or mother's own involvement in children's social care. And then we are also using the information to understand the flow of children in and out of the care systems across the nations. I think today I'm just going to focus on the maternal characteristics. Oh no, I'm not actually. Sorry, I've forgotten about these few slides I put in. So these statistics I'm going to show you are, however, just based on our Welsh data. So we looked at children's social care involvement between 2016 and 2021. All children aged 0 to 5. We used the ONS mid-year population estimates to calculate the rates. Okay. So this graph shows children receiving care and support. And we can see that there's been a slight increase in children looked after, but children on the Child Protection Register has remained relatively stable. And there's been a slight decrease in children receiving care and support. Okay, and then I'll move on to these line graphs, which show the breakdown by the younger and the slightly older age groups under year 1 and then 1 to 4-year-olds. And you can see the slight differences there. And so, for example, if I just pick up 1, you can see that the children care and support has been fairly stable for under 1-year-olds, but there's been a slight drop in the older age group there. Okay. So what about the maternal psychosocial risk factors that we've looked at? So our group included mothers aged 12 to 60 years who had a live birth between April 2002 and March 2020. Again, just to kind of highlight there that sort of amazing ability with cell data to look at such a long time span, so it's 18 years. We wanted mothers who had a complete Welsh GP registration and Welsh address history the year before giving birth. We looked at a number of data sources, including health, birth episodes, education, and then, of course, the children's social care. And a number of psychosocial risk factors listed here. I'd just like to acknowledge actually Grace Bailey's work here. She's a data scientist based within my team. So The first graph on the left shows the number of births, and you can see there's been a slight drop off in recent years. And then you can see on the graph on the right, births according to deprivation status. So fairly stable. You can see a slight, obviously, mothers living in difference by deprivation there. Okay. And then as we have primary and secondary care records, so primary, so the GP records, and then secondary, we've used here the inpatient records. You can see that for common mental disorders, there's been a increase in diagnoses of these conditions since around sort of 2015-ish here. Obviously higher levels reported in GP data. Okay. And then this graph is focusing on severe mental illness. This is an example of bipolar disorders, obviously very small numbers, but you can see the increase in inpatient records for this condition. Substance misuse, so fairly stable, fairly similar events recorded in GP and hospital records for alcohol use and then for drug use. Again, a slight increase here, and then it's sort of dropped down and has remained fairly stable. So just in summary, we can see that highest proportions for conditions are depression followed by anxiety, both slightly increasing over time. And we've also seen an increase in severe mental illness, whilst alcohol use and drug use has remained relatively stable over time. We have, I've not shown you the graphs, but we've seen also looked at domestic violence and abuse, and we've seen a decrease in diagnoses or recordings of this within GP data, but it's remained relatively stable for inpatient data. But of course, I'm very mindful that for some of these conditions, we may only be seeing the tip of the iceberg, and we're only seeing events for mothers who have actually presented to health service for these conditions. So what's next for this project? So further work on the harmonisation of data and analyses across Wales, Scotland and England. And then, of course, we're doing this in parallel to all the other work packages. And then we will be bringing together our findings in terms of drafting of recommendations for a new longitudinal study. I have particular interest in use of admin data through my research, also longitudinal cohort data. And I think to some extent, the answer may well be that the use of longitudinal study data linked to admin data is also a potential viable way to gain greater insight into some of these children and their families. Okay, I'd like to move on to a current project called, it's our Community Catalyst project, also funded by the ESRC, focused on the same group of children, so children at risk of poor outcomes, and our focus is particularly those involved in receiving child welfare support, collaboration between 5 universities. So what are we trying to do? We're trying to bring together, or we're trying to increase the use of admin data in this area, but also we're conscious that a lot of the research that goes on is very fragmented. So we're trying to kind of build that community to support more joined up working and then to improve pathways to impact. So 4 work packages, we've development of a national research agenda, We're trying to build capacity to use the admin data sets through a series of events, and we've developed a website, a microsite, where we're kind of posting resources, bringing researchers together. We're also demonstrating use case examples, and we've carried out some workshops, and then we had funding for a research fellow who's using the eChild dataset. He's based at UCL. So this is our scoping review of the evidence. So based on use of admin data to understand children's involvement in children's social care services. So the review, which Grace led, looked at publications from 2001 to 2023, and as you can see, there's been a significant increase in the research that's coming out in this area, which of course is aligned to easier access to data. We also did a stakeholder consultation exercise. This was led by Catherine Tranter at Lancaster University, to gain their insights into the gaps, the importance and the evidence gaps within the area predominantly. And then this was all brought together to develop our research agenda. I don't have time to go through the different areas now, but I recommend that if you're interested, that you have a look at the research agenda. But these are the areas that we came up with as needing additional research. And then I just wanted to highlight eChild. So the Education and Child Health Insights from Data Linkage data set can be accessed via the Office for National Statistics. That brings together the National Pewter database, and also which contains the children's social care records, but also then linked to health data. So within Wales, we're obviously able to do more linkages, but if you're interested in using insights or creating insights from using English data, then that can be accessed. It's free to access the ONS data. And then there's a number of additional profiles that they've also published. And then, yeah, just to say that we are, through our Catalyst events, we obviously have to, we're showcasing a number of examples of research. So this is just a spotlight on early intervention, which is our next event next week. Okay, and then one of the things that came out of that research agenda was really the importance or the need of more research focusing on evaluation. So we just obtained additional funding to focus on this area. So our aim really is again to showcase great examples of projects across Wales or across the UK, which are using administrative data for evaluation within this area, and also challenges and opportunities. And then we'll be running some training events. This is a recent new registry of all government policy evaluations that I think is going to be useful for us. But if any of you work within this area that like to showcase your work, then please do get in touch. So what will success look like for this Catalyst work? We hope that we are generating better knowledge of the research priorities, challenges and the opportunities, increase access to and use of the admin data, obviously transformative insights. We're hoping, or we think we're building a better community of users, and most importantly really is that research needs to inform better outcomes for children and families. So what about the challenges of using admin data? Well, I didn't have to look too far to find a key paper here. This is of course Fiona's paper, and I think that there are still challenges, but I think that improved access to at least some of the data sets that we require is probably helping. So there's been huge investment from administrative data research in terms of raising awareness of their data, new data sets, training, funding opportunities, and also scoping the data access journey for researchers. There are 4 main trusted research environments across the UK that house children's research, children's social care data, for research, and all of these are underpinned by the 5 SAFEs. So they offer, the government's offers access to safe data, safe person, safe place, safe projects, and safe outputs. So that governance enables the research to be undertaken. But of course, there are many other trusted research environments across the UK. And DARE UK, which is the Data and Analytics Research Environment, aims to establish more of a safe and collaborative network of trusted research environments. And then there's a lot of work ongoing at the moment around this federated network, which would allow analysis to be undertaken across the different TREs. So I think that's going to be really instrumental moving forward. In case you're not aware, there's also been an increase in the metadata that's available for use of admin data. So 2 main links there. And if you're interested in children's social care data, then with Cascade, we've established a data linkage website that holds lots of information about the data we have and our resources. And then if you're interested more broadly, there's a children's social care data user group hosted by Jenny Woodman and Lisa Holmes, which focuses on English data. And then this is the website for our Community Catalyst project. So just a couple more slides to finish off, sort of in terms of other areas within other things going on. So synthetic data, I'm not sure if any of you have used synthetic data, but this is artificially generated data that enables researchers to replicate certain characteristics of real-world data sets. This came out recently, this researcher workshop document, so I recommend that. It's a really great read, as sort of an introduction. And then the last thing I wanted to finish off with is a thought about the National Data Library. So this was included in Labour's manifesto. They stated that they would create a national data library to bring together existing research programmes and to help deliver data-driven public services whilst maintaining strong safeguards and ensuring all of public benefit. So there's been a number of publications recently outlining plans for the National Data Library. Some of you may have also seen in the news more recently the establishment of the Health Data Research Service. So it's been a 600 million investment into this new research service. And then there's still ongoing plans for the Integrated Data Service, again, cross-government service, which aims to provide secure access to data. So I think there's huge movement in access to administrative data across the UK, bringing together different data sources. And no doubt in time, I'm sure some of this will also inform what further work that we can do related to children, young people and children involved in the welfare system. Thank you.
Thanks very much, Lucy. That was really interesting. Is there any questions from anyone? Fiona.
Thanks. Thanks, Lucy. That was really interesting and so much going on in this area. So thanks for giving such an amazing summary of everything to do with sort of admin data, children's social care. I had a question about Northern Ireland, in terms of where they're at with their admin data compared to the other three nations. Do you have like, yeah?
Yeah,
Do you have a...
I'm sorry, I'm just going to stop sharing. I think they're slightly behind. So I think that there's some brilliant work going on, especially within this area. So there's some great work going on by Sarah McKenna. I heard her talk at an ADR event this morning, actually. So there's lots more linkages going on. I think that access for other users to use their data is more limited. But it's definitely something that ADR UK are helping to kind of open up and unlock.
Yeah. Great.
Yeah.
Thank you.
Any other questions? Jeremy.
Yeah, thank you for a really interesting talk. I just wanted to ask you about something you said near the beginning, where you mentioned the importance of lived experience, and then also you talked about the value of bringing together, I think, qualitative research alongside administrative data studies. And I just wondered, in general, how common is it that studies that kind of bring together administrative data analysis and qualitative research? Because I guess within like trials it's pretty common, but I was just interested in how common that sort of mixed methods approach is when the focus is on administrative data.
My feeling is it's not very common, but I think it's an area that's really expanding quickly, because I think there's a lot of people recognizing the requirement for this, especially when working on these types of populations. So I think it's absolutely necessity, and I think it's fantastic for data scientists to be involved in that work, because it's bringing them away from just the data points to understanding each of those data points relates to a person. And it's really to understand those longitudinal insights, you really need to incorporate that with the understanding of the lived experience to help inform then policy and practice.
Jamie.
I am. I've got a quite specific question about the in one of your slides you said you were going to analyze the admin data to inform the sampling strategy for the birth cohort. Can you talk a little bit more about that?
Yeah. So traditionally, the longitudinal birth cohort studies in the UK use some Millennium cohort used child benefit records, and then we've just completed a feasibility project that used birth notifications to understand births and then to select the sample. But I think what we want to do with our project now is we're obviously interested in we're interested in a different sample. So it's really understanding what how many children are involved in the social care system, how many families out there do have these particular vulnerabilities, to try and inform then how we would use administrative data to then invite them to participate in the study. So the second part of that work package, Jamie, that I've not really gone into, is then discussing with data controllers. So we've spoken to obviously director of the Cell Data Bank, to NHS England and other data controllers, to understand if admin data can be used to then to recruit families, because it's obviously a very difficult situation, because the records that are held within trusted research environments, for example, SAIL, can't be used to then re-identify families. So what we want to do is we want to actually work with data controllers and say, we know that this number of families, broadly have these circumstances. These are the types of families we'd like to tap into. Is there a way of, working under the correct governance that we could then contact those families? Overwhelmingly, it's been a fairly positive response to doing that, but I'm really acutely aware that I need to make sure that we as a team and myself feel very happy with the the ethics of doing that as well, because we're obviously looking at very particular vulnerabilities. So yes, lots more to consider.
Thanks. Any other questions? I think I'll ask another one. Oh, do you want to go first, Fiona?
It was only a quick clarification of what the government evaluation central list thing is called. I was just trying to Google it and I couldn't find the link, but maybe if you could just, I don't know, email it and we can circulate it round. Thank you.
Yep, I'll put it in a chat as well.
Amazing, thank you.
Jeremy.
Yeah, it was just a follow-up to Jamie's question about the study that he was asking about, and I wondered how you bring together like multiple sets of psychosocial risk factors, because when you were talking, they seemed quite diverse in terms of where the risk might lie. Was deprivation one of them?
Yeah. So we yeah.
And then some of them felt like was it about neurodevelopment? And then so I just wonder how do you, is there a sort of a conceptual framework by which you bring those different risk factors together?
I guess we've gone with very traditional family vulnerabilities. I'm really conscious when I talk about the word vulnerabilities. Actually, I know that it's a really tricky word in how you define these populations. So not quite sure I always get that right. But, you know, there's circumstances that we know are common for children, at least, who are involved in this social care system. So we know that some work we did within Wales, we found that mothers whose children were involved in care proceedings are 8 times more likely to have records of domestic violence and abuse. So there's certain characteristics that we know are more common, and that's sort of the group or the characteristics we're looking at in the first instance.
Thank you. It's really interesting.
Thanks. So I was going to ask a question about the first study that you talked about. I'm sorry, I can't remember what it was called, but you were talking about linking the data sets from family court data and Ministry of Justice data, and this was for women, both who've had custodial sentences and non-custodial ones. And I'm less familiar with routine data, so sorry if it's a naive question, but I was just wondering what kind of identifiers you would be using to do that, and also what the challenges would be for those women who've had custodial sentences who were then based in England, but you were looking for Welsh, at a Welsh cohort. I just wondered what the challenges were there.
So all data within the cell data bank has no personal identifiers, of course. So we're using unique numbers, identifiers to link data sets. And so we would be able to understand really mothers who are involved in the criminal justice system and the family justice system for England and Wales as a whole. And then the part for Wales is a sub-study, because I think for those mothers within Wales, we'll then be able to look for them to see whether they have children who then go on to receive welfare support or end up in care.
Okay. And so there's no challenges there with women then who are based in custody in England being able to access that data?
No, so it's all being supplied to the cell data bank under a data sharing agreement with the Ministry of Justice.
Okay. Thank you.
But it's important to point out, due to the sensitivity of the data, anyone that accesses data of this type, whether it's through SAIL or other trusted research environments, they have to, there's so much governance around that in terms of their safe researcher training, etc. So, yeah.
Great, thank you. Any other questions? No, okay, so I think we'll wrap it up there then. It's just a reminder to everybody that this session was recorded, so we will pop that up on our YouTube channel as usual, so you can access it later. And then our next meeting will be 17th July with details to be confirmed. And thank you so much for coming along, Lucy. It was really, really interesting to hear all that breadth of work.
Thank you. Thanks for your questions.
Thank you.
Take care.
Thank you.
Thanks then. Bye-bye.
Bye.
Bye.